of a chance of showers and thunderstorms. Let's take it over to Tessa at this time.
I'm here on location in West Ashley at Coastal Vascular and Vein, and today we're going to be talking about varicose veins, and joining me is Dr. Adam Kiefer, and we're going to talk about some symptoms that you should be made aware of and some of the options out there for treatment. Dr. Kiefer, thank you for having us.
Thanks for coming.
Now, first let's talk about varicose veins. What is it?
Varicose veins are dilated veins. They're usually non-working veins. We have veins in the lower extremity, and those veins tend to, over time, become diseased, dilated, and leaky. And that's really what causes the varicose veins.
Okay. So it's as you age, is that something that everyone is prone to, or is it hereditary or what?
It is hereditary. Some people do not get them, and some people get them pretty severely. So it really depends on hereditary factors such as standing for excessive periods of time, hormonal influxes, and to be honest, it really comes down to most patients. It's the symptoms that really drive the long-term decision on whether they should seek treatment or not.
Okay, well, let's talk about some of those symptoms, how someone can tell just a regular vein that you may see through the skin versus one that is considered varicose.
Are the veins that you see on the skin are kind of a reflection of what's going on underneath the system or in your leg. They are markers of what potentially could be more of a serious problem. And when the veins you see are dilated on the surface of the skin, that usually represents the veins under the skin have become leaky and not working well. It's really about a lot of pressure on the system, and that pressure should be stopped by valves and the veins by working well. When they don't work well, that pressure builds up. All that blood, all that fluid goes into the veins and causes them to be dilated and cause pain.
I was just about to ask, is there some pain that's involved with that? And does it vary?
It does. There's a whole host of symptoms. Itchiness, some people have restless legs. They attribute a lot of that time could be varicose veins. And then pain, swelling, and worst case scenario, staining your skin or ulcer formation.
Wow. Okay, well, let's talk about some treatments because people should know that they don't have to live with this condition, correct?
Absolutely not. We offer here at Coastal Vascular and Vein a complete treatment of varicose veins. Oftentimes we like to treat the underlying problem vein before attacking those veins that are visible, such as the spider veins and the visible varicose veins on the lower extremity. We do that right here at our office 95% of the time, usually same-day surgery. Patients come and go within a few hours of their procedure, and the procedure itself is relatively painless and is very successful long term.
Now, let's just say if someone were to have the procedure in the morning time, are they able to resume their normal activity after a certain amount of time that same day?
Usually, we usually recommend that they take it easy the rest of the day, but usually most patients by the next day are back to work, back to functioning, driving the kids around or working out. So.
Now, is this prone to anybody of a certain age? What's the youngest someone can get varicose veins?
Right. When you're younger, you usually have varicose veins. It's usually related to genetics, or hereditary, or hormonal problems. As you age, veins become leakier and don't work as well. Both processes are probably related, but we tend to see patients who are older with a lot of painful varicoses and ulcers. Younger patients are more of spider veins and pain when exercising or being active.
And of course, people should know that they can get treatment right here at Coastal Vascular and Vein, right?
That's correct.
All right, so just come in, see you, get a consultation?
Absolutely.
All right, there you have it. Thank you so much, Dr.
Thanks for
Kiefer.
coming.
All right, more Low Country Live coming up right after the break.